Normally you go in with a hysteroscope, you can see both ostia. Now when we have these prominent lateral walls, we cut the lateral walls. Here I'm doing it again with my monopolar knife. The procedure is referred to as lateral metroplasty. It is still controversial whether it does much good, but I'm sure all the IVF experts are very happy because it definitely gives them a larger cavity. So that way we cut enough so that we can see that ostia clearly. Can you see that? So that's the shoulder, as they call, or the prominent part of the T which we have cut. Do that on both sides, and if needed, we cut the fundus also, because very often you have an arcuate fundus. So this is the procedure called lateral metroplasty. Finally, we go into uterine hypoplasia. If you have a small uterus, many years ago we would go in hysteroscopically, make incisions to try make the cavity larger. But if the volume of the uterus is above 22 ml or above 25 ml, please leave the uterus alone, because you're definitely going to do more harm. Today, surgical options to enlarge the cavity are really not scientifically accepted. So we do not do surgery now to correct it. We would still prefer to give drugs to correct it. So we've gone through all the anomalies which are there in the AFS-ASRM classification. There are several small gaps here and there, but I haven't gone into it. What we are currently doing is now trying to treat the absent cervix. We are doing a laparoscopic anastomosis of the uterine fundus to the vagina. It's still early days. We have just done about 3 cases, but the results are reasonably good, because all other methods of doing that anastomosis have been very difficult. So the important question is, between the young girl and pregnancy, you stand. Who should treat? When to treat? I think that's the most important thing. These are not things to be done by the occasional practitioner. I think if you have a problem, please send them to somebody who's been doing it a little more frequently. Because if you mess up once, whoever and however good they are, they're not going to be able to do anything. So in other words, it has to be done in a place with the ability to do the scan, to do the imaging, and then go ahead and do the procedure. So in conclusion, I'd like to say that uterine anomalies form a small segment in reproductive problems. The proper, complete diagnosis is essential, otherwise your treatment is not going to work out. And treatment is specific, anatomy, and symptom-based. The results are variable. Again, you saw the different situations each time, different things which we did. So I'd just like to leave you with the words of the father of our nation, that you must be the change you wish to see in the world. And if you want the world to change, you have to be more rational in your approach. Thank you very much.
Thank you, sir. Thank you very much for the elaborate